So we had understood large intestine, small intestine differences. Now what we will do is we removed the small intestine here. This is the large intestine. Now what we did is this is the small intestine. You can see the difference, large intestine and small intestine. We have cleared out nicely, removed out all the fat to show the blood vessels supplying the large and small intestine. What you have to remember is the extreme end of the large intestine where the small intestine is joining into it. Okay, this particular area, this big dilatation is called as the cecum, right? Cecum means blind pouch. Now from the cecum we will get, and small extension, downward extension is called as appendix. Okay, so we can see appendix also along with the cecum, right? This is the ascending colon. Here you can see circulations very nicely. Appendices epiploic are removed here, you cannot see them. Now you can see that this is the cecum and this is the appendix, right? Now even if you remove of all this particular areas, then we will see posterior abdominal contents. Now in posterior abdominal wall contents, first thing I'll go for is the duodenum and the pancreas. Now here, remember that in the specimen of duodenum and pancreas in dissection hall for your exam also, we will not keep pancreas separately. Always remember that pancreas along with the duodenum is removed from the body. So we will keep these two structures together for your examination. Okay, now in the pancreas, how to identify? See, what happens is you will see a tubular structure, you will see glandular structure. So once you see both of this, then your next answer should be it is pancreas and duodenum. Okay, so in the pancreas you may not see very nicely and all the structures of pancreas, because while removing and cleaning some portion of pancreas might be removed. So if it is there, it is fine. If it is not there also, you can easily understand that this is the head, rest of it is the body, and the extreme end is the tail of the pancreas. Okay, so now based on this we'll ask you some more questions like what is the pancreatic duct, what are the blood vessels supplying pancreas. Okay, what are the main important relations of the pancreas? Mostly just identification is the first important question anyone will ask for. Okay, so once you identify the organs, then we'll go for the next questions. Duodenum and pancreas are important for even your theory. Now see here, this is the spleen. Again, this is also retroperitoneal structure. Behind the spleen is covered by peritoneum, but along with the tail of the pancreas you can see the spleen. I guess all of you had seen the spleen in the dissection hall. So it has got two surfaces. One is the diaphragmatic surface, which is adjacent to the diaphragm, and the middle one, which is inside present, which is towards the body present. This is called as visceral surface. Visceral surface gets in relation with the stomach. See here, gastric impression, stomach is giving an impression here. Now this is the tail of the pancreas at the hilum of the spleen. Now below this here, there will be the large intestine which is coming here and going down. So colic impression will be there. If you raise all these three things, now there will be the kidney. Okay, so there will be renal impression, there will be colic impression here, there will be pancreatic impression and the gastric impression, right? So these are the viscera in relation with the spleen, right? So I hope you understood the duodenum, pancreas and the spleen. Now next portion what we will see is, once we remove all these structures, we will see the posterior abdominal, extreme posterior abdominal wall contents, that is the kidney and the suprarenal gland. Now kidney and the suprarenal gland. Kidney, I guess all of you had seen the kidneys in the dissection hall. Anterior surface is more elevated, posterior surface is flat. So by that we'll understand which is posterior surface, which is anterior surface. Okay, next is identifying which is the right side kidney or the left side kidney. How to identify right side or left side kidney? By the structures at the hilum. right? At the structures at the hilum, what are the structures at the hilum? You will see renal artery, renal vein, and renal pelvis. Renal pelvis always at the bottom, okay? Renal artery above and renal vein below. So you will see that artery, vein, and the renal pelvis. This is the renal pelvis, which is coming down as ureter into the pelvis, right? So these are the structures at the hilum of the kidney, and this is a suprarenal gland which is in front of it, above it, right? So these are the major vessels, abdominal aorta and inferior vena cava. So we'll not discuss about these particular parts here. So I hope you understood all the abdominal organs identification, keeping it anatomical position, and structures related to it. At least you should be able to write a short note question on each of abdominal organs. Now let us see the pelvic structures. In the pelvic structures, you will see that first thing is, we'll keep the entire pelvis in front of you. And there will be a male pelvis and a female pelvis. First question for us to identify is, which pelvis is this? Male pelvis or female pelvis? Now understand the differences here. Male pelvis, mostly if you get the entire section, sagittal section, it's easier to identify. But remember that in our dissection hall, we are not giving the sagittal section. We are keeping only sagittal section till here. Okay, so you will not be able to see penis and the scrotum here. So you cannot see the external genitalia. So only till here you will be able to see the pelvis. So here, this is the difficult portion to identify because both looks almost same. The sagittal section of female pelvis also, from here to here you're going to get. So first identification feature is whether it is male or female, which is going to be difficult for you to understand. Now see here, anterior to posterior structures. First thing what you have to do is feel for the pubic symphysis. This is the pubic symphysis, the bone. Okay, you have to keep your fingers on the pubic symphysis, feel for the bone. So pubic symphysis. Now you know this is the anterior side, behind all structures are posterior side. Okay, first identification feature is look for pubic symphysis. This is in case of female pelvis. Now in male pelvis also, this is the pubic symphysis. So feel the pelvic bone, that is the pubic symphysis. First feature. Number two, what you will see is, now you know which is anterior and which is posterior. This is the posterior side. Posterior side, you can see the sacrum. Okay, in front of the sacrum, you will see the rectum and anal canal. Anal canal is very short. Rest of all space is the rectum. Rectum is a dilated portion, very well seen. So some of the students mostly confuse this with the uterus. Okay, uterus cannot be seen like this. Uterus wall is very, very thick. Okay, so remember that in between the rectum and bladder, see guys, you have to remember that bladder may not be this nicely dilated. Mostly it will be collapsed and you will see a smaller dilated area. Okay, so this is how you will see bladder just behind the pubic symphysis. Either in both female or male pelvis, first opening what you will see is, first cavity space what you will see is the bladder. Okay, next point what you have to see for the identification is below the bladder. Feel below the bladder with your fingers here. When you feel with your fingers here, this point, if it is very thick, here, this is called as prostate. Okay, in male pelvis only you will see prostate below the bladder. Okay, so below the bladder, if you can feel a thick hard area, okay, first pubic symphysis, then comes the prostate below the urinary bladder, then that is the male pelvis, right? So because even though, see, it seems very simple and easier in this particular sections, but in the section hall the experience will be completely different. So you have to understand that. So you have to feel for the pubic symphysis, you have to locate the urinary bladder, and below the bladder try to identify the prostate, feel for the prostate. When you feel for the prostate, if you can feel the prostate, then that is belonging to the male pelvis, and if there is no prostate, then it is the female pelvis. You can easily understand. Now next section, next point what you have to remember is, between the bladder and the rectum you will see uterus in case of female. See here, this is the rectum, this is the bladder. Now you have to understand that the vaginal cavity is very long, and vaginal cavity is collapsed, it is not dilated. So rectum is dilated, but vaginal cavity is not dilated, it is collapsed. Okay, now this is the vaginal cavity. Then we will see that into the vaginal cavity we will see the cervix, rest of all is the uterus. So I hope you can identify the difference between male and female pelvis. In female pelvis, first feature to identify is whether it is male or female pelvis. Number two, when you are seeing female pelvis, you look for the vaginal cavity which is collapsed and the uterus which is always and above the urinary bladder. Okay. Number two, you have to identify urinary bladder based on the prostate which is below the urinary bladder in male pelvis. I hope till here it is clear. Can anyone still who did not understand raise your hand? If you did not understand this particular portion, how to identify pelvis, male or female, please raise your hand. Yes, tell me, Murtaza.
Ma'am, the uterus part that you had said right here, I did not understand that how to identify it.
Uterus we'll discuss. Okay, but can you identify male and female pelvis?
Ma'am, about
Yes.
female.
Yes, tell me.
Ma'am, how to identify for the female?
If not male, then it is female, isn't it? Okay.
Yes.
So what you have to do is first feel for the pubic bone. Okay, first point of identification. Number two, feel the prostate below the urinary bladder. You see the cavity above the pubic symphysis, you will see the urinary bladder, and below the urinary bladder, just press your finger, okay, with your thumb or index finger, press below the urinary bladder. You can feel the prostate in male pelvis, okay. In female pelvis, you will not feel the prostate. So with this, you can identify whether it is male or female, okay. Next point of identification is, rectum is always a dilated cavity. Okay, you will see rectum always a dilated cavity. Don't confuse this with uterus or bladder. Some people study the pelvis from this side. Okay, they feel the rectum and say that this is pubic symphysis. No. First identify which is anterior side and which is posterior side. Why I'm telling this? Because when we take a section, remember that the posterior aspect is removed off, anterior aspect is removed off, bottom is removed off, above is removed off. So you cannot make difference which is anterior or posterior side based on external genitalia or what is seen from outside. No. What you can see is only pubic symphysis. Above that, you will see urinary bladder, and below the bladder, if there is prostate, then it is male. If there is no prostate, then it is female. But remember one thing, you can only feel the structures, not by seeing it. You have to feel the structure. Then only you can identify prostate. Am I clear till here? Any questions? Okay, we'll move to the next portion, that is uterus and vaginal cavity in detail. Okay, now see here, This is the vaginal cavity, uterus inside it. Now, how to identify uterus? If you feel the rest of the structures, that is rectum, urinary bladder, all are thin walled. Okay, feel for the structures, all are thin walled, but uterus is a thick muscular organ. Okay, you can feel the thick muscular organ which is sitting above the urinary bladder. Okay, that's the uterus. So uterus will always be having parts. There is the fundus, body, and cervix. Now what you have to clearly observe is cervix is inside the vagina. Okay, remember that cervix is inside the vaginal cavity. Okay, now why I'm telling you this point, this also will help you to identify uterus. Okay, so some people will say this is bladder and this is rectum. Okay, because they don't know which is anterior side and which is posterior side. What you have to observe is the uterus is always anteverted. Anteverted means, see here, the bending of the uterus, it is flexed, it is bent towards anterior side. Okay, this is called as anteverted uterus. Okay, the position of the uterus is anteverted and anteflexed. What is the meaning of these two words? Anteverted means between the vagina and the uterus there is an angle formed here. This is called as angle of anteversion. Okay, now from the cervix and the body, here also there is a bending, okay, between the cervix and the body. This is called as angle of anteflexion. Okay, so we have uterus mostly in 95% of the cases, uterus is anteverted and anteflexed. So which side the uterus is bending, that side will be your anterior side. Okay, so this will be anteverted anteflexed uterus. It is sitting over the urinary bladder. Okay, so clear till here? Anyone still could not understand anteversion and anteflexion? Please raise your hand. Right, clear. So now, yes, tell me.
Ma'am, can you please explain anteverted and anteflexion again?
Okay, now see here, uterus,
Yes,
can you see uterus is lying over the urinary bladder. Okay, see here, vaginal cavity is going backwards and upwards, whereas uterus is forwards and downwards. Okay, right? So here there is an angle, first line here and second line here. So there is an angle formed between the vaginal wall, vaginal cavity and the uterus. This is called as anteverted uterus. Okay, uterus is bending like this. So let's say this is the vaginal cavity, this is the uterus. So here vaginal cavity is going backwards and upwards, whereas uterus is falling forwards and downwards. So there is an angle here. This is called as angle of anteversion. Now, if the uterus is like this, here is the cervix and this is the body of the uterus. There is a bending here between the cervix and the body of the uterus. This is called as anteflexion. Okay, angle of anteflexion. So usually uterus is anteverted and anteflexed. Okay, so this is called as angle of anteversion and anteflexion. So uterus is mostly, we will see anteverted and anteflexed uterus. That's why when we go for pregnancy scan and all, they ask to drink more water so that the uterus is bulged. Sorry, not the uterus. Urinary bladder is filled so that the uterus goes backwards and stand straight, so that from anteriorly we can easily scan the uterine cavity. Okay, because uterus is falling on the urinary bladder. Urinary bladder bulges, then the uterus can nicely stand straight like this. Okay, as you will see in your textbooks, uterus is not standing like this with the two fallopian tubes on both sides. Uterus is bent like this. Okay, that bending is called as anti-flexion and anti-version. Okay, so am I clear? Any more doubts still here? Okay, fine. So now let us go to the next part. That is the, now we know
Ma'am,
identification.
ma'am,
Yes,
we have a lecture at 11:30.
yes. We are, we'll just finish it quickly. Okay, so we'll just finish it in 2 minutes. We'll just finish in 2 minutes. Okay. Now see here, now we know how to differentiate between male and female pelvis. So here we will see there's some supports of uterus. This is called as, this area, how we are looking at it, we are looking from the bottom. This is called as perineum. Okay. From the perineum we are seeing what is the main support for the uterus is this muscular support which is supporting the uterus from bottom. Okay, this is called as pelvic diaphragm. Pelvic diaphragm is formed by the levator ani muscle, okay, which actually gives support for the uterus from below, because that bulky uterus during pregnancy can come down because it is just inside the vaginal cavity. So if the uterus is bulging, it will fall weight on the vaginal cavity and it can come out. Okay, this is actually when the uterus, even if there is no enough support for the uterus can come down from the vaginal cavity to the exterior. So what we do for this is, this is the pelvic diaphragm which gives support to the uterus from bottom, and there are various ligaments which also help the uterus. This is the uterus from laparoscopic view. See the ovaries are bottom. This is a posterior side of the uterus. These are the fallopian tubes. You can see the fallopian tubes which are going backwards like this, and this is the anterior aspect. These are the ovaries which can be seen. Okay, so there are some ligaments. This is called as round ligament of ovary, okay, which is coming from the uterus, which supports the uterus. There is one more ligament which is on the both sides. If you see, the uterus is held to the pelvic wall by a big ligament called as broad ligament, okay, which holds the uterus in place. But remember that these are only false ligaments. These are not actually supporting the uterus. The main ligament which is supporting the uterus is the pelvic diaphragm, from which is supporting from bottom. Also, there are so many muscles which are joining at the perineum to a small area called as perineal body. So that perineal body is giving support to the uterus from bottom, right? So these are the main supports. Rest all are false supports, or not true supports for the uterus. So just go through the uterus lecture, uterus chapter. You are supposed to be writing about all these organs, at least 5-mark question about each organ. Okay, so because they are not long questions for you, so just go through, and if you have any questions you can get back to me at any time. Okay, so any more questions you can get back to me. Now I'll end this lecture. Okay, these are the ligaments showing. That's all. Thank you.